Thank you for coming. My name is Katie, and I appreciate you coming to give us some insights today, hopefully.
Did you fly in from somewhere? Or
No, I'm from Chicago. I live in Logan Square, but my office is out by Oak Brook.
That's better drive from Logan Square.
It is. But,
Especially in Chicago traffic.
Yes. Now it's my time to kind of wake up in the morning and decompress in the evening. So, all right. Well, maybe we can just go around and do some introductions real quick as we get to know each other a little bit over the course of the next hour. Mary?
Hi, I'm Mary, born and raised in the city. I'm a sales manager, just in Humboldt Park, and not quite sure how
No,
else
that's
to say.
fine. That's fine.
I'm Sarah. I'm a teacher and I live in the city.
Great.
I'm Marissa. I work in higher education and live in North Rogers Park.
I'm David Lauer. I live right next to Wrigley Field, and I'm a writer.
I'm Elise. I work and live in West Loop.
I'm Scotty. I am a choir director. I live in Rogers Park as well.
Yeah. Very nice.
I'm Leo. I'm the only one here that does not live in the city of Chicago. I live in the suburbs, northwest. It took me about an hour and 15 minutes to get here today.
Yeah. Well, thanks for making the trip.
I work as a delivery director for an international software company.
All right. Well, thank you all for joining. I have a few computer screens just so that I can be able to kind of show you a few things we can talk about. Hopefully you all had a chance maybe to look at what we call a decision aid. And want to ask you more specific questions about that. So I, of course, have a list of questions I kind of want to get through, but, want to make sure that if you have any thoughts along the way, please interject and, obviously just being respectful for everybody and, trying to let everybody have a voice. So that is what we're looking for. So I'm going to dive right in, and then we'll kind of take it from there. As you maybe looked at when you looked at the decision aid, our goal is that we're trying to, and we've developed these in a couple of different spaces, and trying to help people better understand their treatment choices, understand maybe what are some of the things that are important to them, that really giving them some time to think about. Is it avoiding some side effects? Is it the way and how well the drug works, and maybe the impact on their kind of daily life? If you think about some treatment modalities may not always just be a pill, and then that there are other options, and what does that mean for their working life, their social life, and those types of things. So trying to help them understand that, think about those things, and have them try to get that understanding of what really is important to them. And then that, in theory, has been shown to help facilitate that discussion with their clinician, as they talk about what treatment choices. So we appreciate that, this condition may not be exactly relevant to all of you, but trying to, get your thoughts, if you can kind of put yourself in this position of, if you were to, have this condition, looking through it, even if it were something that was more relevant to you, thinking through just, how would it help you understand a little bit more about your condition, understand a little bit more about those treatments, and how it might help you with a decision, if at all. So that was kind of our goal as we developed this, and we're in a process where we worked with experts as well as a patient to try to work on the content, and now we want to refine it and get your thoughts and feedback on that so we can hopefully make it better. So with that, just kind of want to get your thoughts on how you think that this decision aid might help patients recognize that a decision even needs to be made. So do you feel like, as you went through it, that it helped you think about that, putting you in that position of being able to make a decision, and that there might be a decision to be made?
I actually remembered when I was looking through this guide, I remembered originally when I was diagnosed with depression about 5 years ago, and how difficult it was, especially the first couple of weeks, because you don't understand what's going on with you. And some of the first things that get impaired is your decision-making ability. You can't make any decisions. It's difficult, very difficult. And so I remember back then, if I was presented with a guide like this, and I was told you need to pick, I would probably be paralyzed. And so to me, in reality, thinking back to that time, because I would imagine people that are looking over these things, some people at least could be in a not a very good mental state, and if they have to make a decision and a decision doesn't get made for them, for their best benefit, that could be problematic from the standpoint of a person would be like, I would be like, I don't know.
Okay.
I really don't. So that might be one of the things that I was thinking about when I was going through this. Plus, there's also information is very useful, but there's a lot of it too. And
Yeah.
I thought it would could benefit from being a little bit more concise.
Okay. Any other thoughts, just as you're kind of in that maybe treatment decision? Is that a time that's just more overwhelming? Is this something that would be useful as you go home and think about it, or?
I took it as they've been on medication for a while.
Yeah.
And then realized it's really not helping at all. So here are some other choices you can talk with your doctor about.
Yeah.
So I thought it was very informative
Okay.
that there are other choices besides medication.
So at that time, to you, maybe that decision isn't quite so overwhelming because you're really just thinking, hey, this isn't maybe working. Yeah. Okay.
I looked at it from, the first aspect that really jumped out at me was how easy it is to understand if you're not in that position. So my family didn't understand much about this at all when I was diagnosed 22 years ago, I think. And, growing up, there was very little depression. It was a lot harder core then.
Yeah.
And this wasn't taken quite as seriously. But now it's more mainstream, and people seem to understand at least what it is and how it affects people. But having this kind of clarity for you to be able to show someone else that isn't familiar would be very, very helpful.
I did not. One of the things that I thought was missing from this was some sort of summary of everything that maybe could be printed out to guide, or a discussion guide to have with your doctor or your care team. I know for me, it's not just one person that's helping me manage my depression and anxiety. It's a multitude of people, and so having maybe some questions or things to think about with my doctors, especially because a lot of these, or some of these treatments have, major side effects like seizure. A seizure is not just something minor.
Right.
As someone who's had one, it's something that would not only need to be talked about with my psychiatrist, but my entire care team.
Yeah, and the goal is, sorry, because this was, it's not quite live. The goal is that we would have that, but that's, a good point to maybe make sure that we're including questions to, be really facilitating that, as well as the goal would be to, as you answered some of those questions about what your kind of treatment preferences are, that those are things that you can take so that you can, really have those discussions. But that's a great point, that it wasn't clear through this mechanism that would be available.
Is the goal for this to be given to a person by their care team?
So they can work in different ways, and that's something we're kind of still working out, but, like your thoughts on that too, right? Would it be good to come from a healthcare professional, so as you talk to your doctor, some of them, are done that way, that, they say, hey, here's a website we'd like you to visit. It will kind of go through some of the treatment choices that we've talked about. Then we can kind of come back and have another discussion. Some may be available through an advocacy organization, or be more publicly available just if somebody's interested and just trying to seek some more information. Any thoughts on where that might be? Best fit, sorry. fell asleep on us. There we go.
I don't know, just for myself, the care team is probably the only avenue that I am in touch with.
Mm-hmm.
You know, there's no like advocacy team or, I mean, commercials I've seen,
Yeah,
but
not something that you have seeked out. Anybody else kind of seek the internet for, you know, whether it was your depression or just other?
I think
Kind of
basically
healthcare-related things?
everyone that I've known, and my class, myself included, I always go online to look at things that bother me. I have an ache or a pain or I feel something that I don't normally feel. The internet is the first place that I go to look for it.
Okay.
And then I schedule an appointment with my doctor, and then I go and I seek out, I'm like, okay, this is what seems to be the problem. I think I have that. And so I've even discovered a lot of times you would go to a doctor and they'll like give you a couple of options of what could be going on, but the internet, I was able to, in other words, I was able to self-diagnose myself with the help of internet much quicker, faster than I could do it with scheduling an appointment with a doctor and then going and waiting and talking to them. It's very helpful.
Do you feel, though, that it might be more trustworthy, you know, coming from if your healthcare provider has given it to you versus something you maybe found on the internet? You know, would that help you feel more comfortable that this is something credible and worth?
If the healthcare provider would accompany this by some kind of a summary. So if they were just going to give this to me and say, hey, go home and read through it, I probably wouldn't think of it as much of credible information, as opposed to they would say, okay, let's sit down for 10 minutes. I have this guide here and we can talk about it together and decide what, you can go home and look through it deeper, but I just want to give you your options, and here's what your options are. Maybe this had, and I remember this did have summary at the very end, and if they could just go through those last pages and say, okay, we have electroconvulsive therapy, we've got these nasal things, and there was one more procedure which I don't remember having to do with brain function again. We have these three options. Go, I mean, this is what I would recommend, but go through it yourself and see what you think.
I was going to say that I think like the commercials for depression are kind of lame because they show a person like moping around and it's dark, and then when they have their medicine, all of a sudden they have this happy family, and I'm like, that's not exactly how it works.
Yeah.
And so yeah, I'd want to talk to my doctor, my neuropsychiatrist, or my neurologist, or
Yeah. Yeah. And that is the point of these, you know, that they shouldn't be done, you know, where you've now made just the decision and you're to walk in and tell it's to really help with that conversation. I guess, do you feel like it maybe would help with that conversation in terms of just, maybe we start with just understanding the treatment choices? You know, do you think that it helped for obviously treatment-resistant depression, that what the treatment options were? Do you think that was kind of well covered, or anything that might be better elucidated?
It was well covered, provided you gave this 20 minutes of your undivided time.
Yeah.
You have to be motivated, I feel like, to actually go through all this material and read through it. A person that's taking medication and it's not working well, I'm imagining, because I've been there, I'm always worried, why is it not working, what else? And so there's a lot of things in your mind. Reading materials might not be something that, if your doctor sits with you and says, okay, this is definitely going to help, I want us to go through this together, I think to me that would be much more motivational as opposed to just going through this myself.
Okay. Anybody else think that it was too long, or?
I think it's too long if you're going to go in and have a conversation with your doctor right then and there. Like, if it was something that, you know, was sent to you through MyChart, or, you know, one of the online portals from your team that before.
Yeah, not something you want to sit in a waiting room and try to take it all in.
Just a nice refresher, so maybe like high level with your doctor, because you know, when you have an appointment, and depending on who your doctor is, sometimes I have some doctors that speak in a language,
Yeah.
like they're talking to another medical doctor. And so I walk out of there like, I have no idea what they just said to me.
Right.
So, to go over some of this, but then have that as like to go back and refresh your memory about what was talked about.
Yeah, kind of as a resource that, and maybe you can't make it through the whole thing, but it's
Yeah.
something you could come back to and pick back up. Do you feel like it also told you that maybe you don't have to make a decision at this time? Did that come through?
Yeah, I felt very unbiased to
Okay.
me personally.
Okay, great.
Especially when it covered and you can still continue what you're doing. And then I like that they talked about all the different types of therapy too, because I don't think a lot of people, and me, I
Yeah.
learned about a couple that I never heard of. So
yeah.
I appreciated the, unbiased.
Did you mentioned kind of sometimes the level of words used and amount of information and how that's spoken. Did this bring it down to a level that was understandable, or were there some things that could be worked on there?
I mean, I appreciated the fact that it was very straightforward about what was going to happen afterwards too,
Mhm.
because I feel like that's a lot of people what they're asking. How's this going to affect me afterwards? What should I expect or not expect? So the fact that you couldn't drive after
Yeah.
the different treatments and like, okay, well, I'm going to have to depend on someone to drive me home, and just really all the expectations that are going to be coming afterwards. I thought it did a good job
Oh, good.
because it's not necessarily something that's always covered in something
Yeah.
like this when it comes to treatments.
Okay, right.
Especially the cost.
Mhm.
When you ever see that.
Yeah,
Right.
but that I assume makes a difference, right,
Mhm.
as you think about things. Yeah, okay. How did you, I'm going to kind of bring up just so we don't have to kind of go through all the screens all the time. How did you like the smiley faces? Did this help? No?
No.
No.
Okay.
Not at all.
Is it because there's smiley faces? I mean, or, if they were people, would that kind of help try to show out of 100?
So I actually think the color does a big
Yeah.
Okay.
service to
Okay.
because it's not, depending on how bright your screen is and different things like that, the green reads very similar to the gray.
Okay, that's a great point.
I
And
just
both
see
in the
green.
text then? Oh, sorry, what did you
I
say?
just see green, like I can't tell the difference between
It's hard,
the text
yeah.
smileys and the middle smileys. I like
Uh-huh.
the concept of what they're trying to do, but that wasn't super obvious. I kind of glossed over it too.
Okay,
Until it was pointed out to me with the question, I didn't even see those. It just looked like an aesthetic
okay.
part of that. I never looked at that as being,
And yeah, so the text, right, is supposed to say, 60 to 70 out of 100. Does that get lost?
I
that
didn't
that
think
is-
it went at all with the smiley face.
Okay, maybe that needs to be, yeah.
Didn't even notice that.
Okay, how about the text in green there? Is that even hard to read?
I think it is,
Yeah.
especially, I don't know if anybody in here is colorblind, but I can imagine that
Yep.
it would read,
It's very
it would be
light.
hard to read if
Mhm.
you're colorblind.
Okay,
If
good
someone's
points.
colorblind.
Yeah.
Yeah,
it's
Okay.
four separate colors in that. I mean, that's a blue, that's kind of an aqua, that's a green, that's a black.
yeah, a little too busy maybe with that.
I would just like to see darker colors, just
Okay.
for more contrast.
Okay. All right.
And if you need to differentiate text, like instead of having them in different colors, you could bold it, you could make it
Mhm.
italic, or
Yeah.
different ways.
Underline
of-
that or something.
Yeah,
Bigger.
Bigger.
bigger. Mhm. Okay, great. Very good. How about just saying 60 to 70 out of 100? Is that, is that statistic, as it were? Is that meaningful to kind of understand how many people that, how that might affect you and what the benefits of that is?
As broad as it is, it's still nice to have up there.
Okay.
Mhm.
Okay.
I think it would.
But maybe even that could be either under, if we created a better graphic or something does that pop out at you? Or that needs to pop out more? What are your thoughts there?
I think the fact that it says it's fully resolved in 40 to 50 people, I feel like that wasn't as
Yeah.
poignant as it could have been.
Okay.
Because I mean, I think that's a very noticeable statistic in my
Yeah.
brain. You're telling me it's going to be solved out of a half of the people that do it?
Yeah.
That's interesting to me.
Okay.
I always I don't know why they chose not to use percentages here, but to me, when I read things through a lens of a percentage, so they would say 60 to 70% as opposed
Right.
to 60 to 70 or 70 people out of 100. I actually don't remember last time I saw anyone forming something like this. You would just normally say 60 to 70%.
Right. Any other
so-
thoughts on whether
I think
percent
that
is understandable
it's-
versus?
Easier for some people to understand it that way as opposed to 60 to 70%.
Yeah. It's just kind of difference.
Yeah.
Yeah. Different way to look at it. So, okay. Do you feel like the decision aid did help think about those pros versus cons? So, as it presented, some of the data about how well it works, but also the side effects, do you think those were fairly evenly presented and understood as you?
I was confused by values. What exactly did that mean
Okay.
on the tabs?
Yeah. Sorry. This might be easier. There we go. So those are kind of what we mean by, there we go, about trying to, have you think about, what is of value to you, right? What is it? Less side effects? Is it less maybe impact on your working life, based on maybe how these are administered? Is it how well it works? So that's what we had meant by values. Was that kind of confusing or a better term?
I would say personal values. or-
Okay,
Yeah.
I like that.
Preferences.
Yeah.
Preferences.
Or goals, I don't know. Yeah.
Okay. Elise, any thoughts there?
Yeah, values, I don't know what word I would use in place of it, but I don't like values.
Okay.
I was gonna say, I knew a woman that went to my coffee shop, got ECT, and I remember she needed to have her partner kind of lead her around in the beginning. And I didn't notice it really said,
It didn't kind of talk about
like,
how that might really impact your kind of daily life.
like
and
that where you need someone maybe a little bit in the beginning, I don't know.
Okay.
But she was very happy.
Well-
She was a totally different person. It was amazing.
Okay.
Yeah.
But those are, the things that we meant by values. Maybe you're okay with,
Mhm.
kind of having some of that at the beginning
Yeah.
for the outcome. Maybe for other people, they don't have somebody to help them out. So that, may be a different decision.
Or maybe things to think about, or
Okay.
Considerations.
Yeah. In terms of just, I guess, color outside of that graph, is kind of some of the blue okay, or just blue maybe in general is not as appealing as, or any colors that I guess you have very adverse?
the blue is fine. I just think that green.
Just that green.
was- yeah, I feel like a lot of medical online things have blue because it's calming.
Calming.
Subtle.
Yeah, okay. Great. Do you think, as you went through this, would it help patients understand that the decision does kind of depend on what they value, maybe prefer, or, what their goals are for their treatment? Did that kind of come through, that we're trying to help, patients really understand that they need to think about that?
Well, I like the questions that are at
Okay.
the top there.
Yeah,
I'm not sure if I need a change.
yeah,
So here's some information.
okay.
I think what Elise said before about questions to bring to your doctor, almost like a starting question to ask yourself, and then if you answer this way or this way, you know, almost like following a question path kind of thing. I
Yeah.
don't know how else to describe it. I feel like that might be helpful, you know, kind of just guiding it down to where, you know, this might be the best suit for you. No change. Maybe these considerations you value the most, I guess.
Okay. In terms of kind of thinking through that, you know, did you like kind of these summary tables? Were those
Yeah, I like
helpful?
them.
Yeah.
Summary tables always, or like to compare, like when
Yeah.
you
Mhm.
can
Yeah.
do a side-by-side comparison.
Okay.
And the coloring's good.
Yeah.
I think the print and save buttons could be probably a little bit more prominent.
Okay.
I don't, like maybe in the middle or I think
Shaded.
or shade it,
Mhm.
something to make them stand out.
Stand out. Okay. Yeah, and this was where, you know, this stuff can be printed. It's just not that active link that
Yeah.
that allowed you to.
Mhm.
But and did you feel like the tool did emphasize that this is meant to be discussed with your physician and, you know, not, you know, these are results, but, you know, you may have some differences versus, you know, the studies that were looked at, and that's why we should talk with your physician about what really is best for you. Did that message come through?
No.
Really?
No.
Okay.
In fact, that's what it lacked more than anything else. It's
Okay.
like, what do I do with this?
Okay.
Other than just informational. You know, I do a search online and this is what I come up with. Well, I would say that's a good find, but, you know, what do you do with it now?
Okay. Okay. So kind of spinning off that, then, I guess, did that also kind of affect your thoughts on how well it really helped you organize your thoughts? Did it not, you know, kind of help you really organize that? You know, we talked about maybe having that, you know, making sure that there's that printout with questions. You know, what else might be needed to kind of facilitate that kind of organizing your thoughts and the information that you've, you know, just kind of read through and received? You think it's, you know, just the kind of having those questions, or kind of the question path as you, Mary, kind of alluded to, that might kind of help organize things better? Or is there anything else that you think might help with?
I don't know exactly what it would look like, but if you went to print it, maybe there would be like additional, almost like this, like space, like if you are bringing it to your doctor to like be able to
Write down.
jot notes. I don't know
Mhm.
if that would be helpful for people, or how if that would be easy to
Mhm.
do.
Yeah. Kind of be able to take notes on it so that,
Well, I like the way that it flowed.
okay, great. Do you think something like this is useful, you know, for either like your family members or significant others? That, you know, would it be something that you could foresee somebody sharing with those
Yeah,
individuals?
oh yeah.
Okay.
Yeah, it would help her ease fears or,
Mm-hmm. Help them understand what the treatment
Mhm.
options are too. Just kind of looking through my notes here. Did you feel that, so we mentioned that we felt like it was balanced, or, you know, any other thoughts there in the sense of just anything that you felt like, Scotty, you mentioned kind of, you know, something at least that you knew about in terms of ECT that maybe
Mhm.
wasn't covered, but, you know, in general, do you think that all treatments kind of covered the side effects, you know, well, and didn't seem to, you know, try to guide somebody really just by, you know, not talking enough about one or the other? That all seemed
Balance.
Yeah, it seemed
balanced?
very
Yeah.
balanced,
Okay.
unbiased.
oh, good. Um, so in terms of just any other when we think about, I guess, as you might be making that decision, so say you've kind of now read this and maybe you're a healthcare professional, how do you think it might be viewed by, I guess, thinking about your healthcare professionals? Do you think that something like this, if, they felt like it was, obviously adequately developed, would be something that they'd be open to talking with you about? In general, for your providers, are they, do they promote of you kind of understanding all of your options and being able to, weigh the different treatment options in front of you?
I think this would be great for a psychologist to go over with you, but for the rest of like my PCP, I would want a customizable thing. This is not just the facts. This is how it pertains to your patient.
Would a PCP even talk about this stuff with you?
A lot of times you start there and then you get a referral.
Right, right.
I mean, all of my doctors all communicate with each other. Everyone from my neurologist to my psychologist to my psychiatrist, everybody communicates with each other because everybody at the end of the day needs to be on the same page about my care and how to best get me there.
Leo, you had mentioned, when you were in that decision, it's kind of hard for you to feel like you could make a clear decision. Do you think that if people that just like their doctor to make decisions, do you think something like this is useful? And maybe it's, that I guess that's actually probably a different situation, right? There are some people that just maybe like their doctor to make a decision versus maybe the situation where you're just overwhelmed and hard to kind of comprehend and take everything in. So actually, I guess thinking about just that person who, maybe relies more solely on their physician, do you think this is something that they might be willing to look at? Or, is this kind of meant for people that are really seeking education and understanding?
Well, I can see my doctor looking at it after would say, oh, we haven't tried every medicine yet, or we haven't gone to the top of the dosage.
Yeah.
We can still add some. But then, I think they would look at some of these things.
And I think it's a case-by-case basis, depending on the severity and
Yeah.
whatnot.
I'm not sure if a doctor, when it comes to these procedures, most of them have different side effects depending on what you choose, like short-term or long-term memory loss and things like that.
Right.
And I think most doctors would probably not be comfortable making that decision for you. So I'm thinking about my doctors and my psychiatrist, for example. He would be happy to go through this with me and reinforce what he thinks might be a good next step, so he might be able to recommend, but he would tell me that you still got to make a decision. But I would come back to him and I'd say, what's your professional opinion? Because you've been working with me for 5 years, you know me a little bit.
Yeah.
And he would say, well, based upon what I know about you, you don't hate the side effects, so you would want the safest option, even though this might be a longer option. So based upon what I think about you, you probably would prefer that. But he would never tell me, okay, we're going to put you on nasal drip or whatever that thing is.
Yeah.
He'd want me to pick, but he'd also provide advice.
Yeah.
Are you saying you're having a conversation with your psychiatrist or your general practitioner?
Well, my general practitioner wouldn't, beside having very general idea about depression, and I don't see that this is something that the PCP would know a lot about. They would know the basic general stuff about it, but the intricacies of what treatment-resistant depression is, and I don't know if I would trust them to have enough information to talk to me about it in an eloquent way.
I feel like with just this in general, one of the things that struck me when we were talking about the 60 to 70 people or 40 out of 50 people, who are these people?
Right.
Like, how old are they? Is there different age groups? Have they been dealing with treatment-resistant depression for 2 years, for 12 years, for 20 years? That just kind of dawned on me because I know I'm different than you, that, I mean, so who are these people?
Right.
So I would probably rely more on my doctor to give me that kind of information to supplement this.
Yeah, and or is there a way that you guys could link back to the original studies
Yeah,
or the medical journals
exactly.
where it was published so that if somebody was looking for additional info,
Yeah.
they could go and find it?
Yeah.
That's
That
kind of
would
what
be
I
good.
wanted at the end. I'm like, additional info. Click and read a little bit more if you wanted to.
But on the
Yeah.
other side, who cares about this stuff? Because we hear summaries and anecdotal evidence all the time based upon studies. I personally don't care who those people are. This is why I brought up the percentages before. It's because to me, it would say 70% of people had this condition. And I was like, okay, well, I mean, I trust that this is providing pertinent information to people with treatment-resistant depression. So those are likely all people with treatment-resistant depression. Now, we don't know what the ages are, of course. But if I don't know what the ages are, I'm assuming that these people, the evidence cited, the facts cited are pertinent to me, the ones that I should care about. Because then if I have to go into notes on the bottom or seek out additional literature, this might consume not 20 minutes of my time, but 2 hours or even more. And at that point, you're like, I'm so confused.
But that's your choice.
Yeah, and if it, I mean, some of these things, as you said, have, you know, as it said, like short-term, long-term memory loss. Like, I want to know as much information, and
Yeah.
I want all of my doctors to have as much information as
I mean-
possible too. So if I'm sharing it with them, I want them to be able to go and dive deeper, even if I'm not the, you know, if I don't understand everything that was said in a medical journal. But my
Yeah.
doctor would be able to understand.
But, and you don't even need to click on it at the end. It's just there for the people who want it
I
there.
mean, you could find that it says 60%, and then you find that it's 80% of women and only 40% of men. or
Right,
something like
exactly,
that.
exactly.
And I guess, do you feel like it came through, you know, I mean, one of the goals is that we provide you with some information, but at some point, that's also where your physician should give you some of that relative background, right? So do you feel like that message did come through, that, you know, we're giving you this information, but, you know, this is where you also need to talk with your physician because they know maybe what, I mean, it obviously isn't stated like that in here, but, you know, they know what these studies are, they know you, they know your treatment history, and those all also should be part of the conversation.
Absolutely. I think that it should just be easy to find if you want additional.
Yeah,
Right.
yeah, sure, yeah, perfect, yeah. So,
this-
yeah, just having some resources. Some people like that information, some people don't.
You couldn't, I feel like I would need to bring a lot of questions based upon all of this. I would need to write down and bring a lot of questions to a doctor and to then discuss. It's not something that you can leave a person with and then not have any input from the psychiatrist or whoever the doctor is. And they would need to supplement this with some kind of extra additional information.
I think it would absolutely need to, almost like a bibliography with all these studies. There
Right.
needs to be
Yeah.
a lot of information.
Well, 'cause
And
like,
would that help you feel like that it's also a little bit more credible, you know, maybe give confidence to both you and your healthcare providers and, yeah. Okay.
I was just curious too, because I've heard, I know ketamine is like an animal tranquilizer. I just didn't know if, like, is that the same? It's also a street drug. Is that the same drug? I don't know.
Right. Yeah, that could be alarming to some people when you see that maybe,
I mean, it might be different, I don't know, but I'm assuming.
sorry, I was just trying to find something while we talk here.
I had like one
Yeah.
sort of this is nitpicky,
No,
but
yeah.
like kind of right now, like you're having to scroll through everything. the one thing, like on the top, if you scroll up,
Mhm.
it'd be great if those were all like hyperlinks, so you could go back
You could go
quickly, you
back.
could hop around, like if you know for sure ECT,
Mhm.
not your
Yeah.
not your jam, or you know, or just be able to go to the summary quickly instead of having to click through, I don't know if it was 30 page, whatever, 27, 30 pages. That was one of the things that kind of just bugged me.
Yeah, 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 and yeah, unfortunately, that will happen. This is just, again, that
Oh,
working
it's not-
version,
yeah, yeah.
but a good, make sure that, you know, that is, that happens, because we had talked about kind of color scheme too, and just kind of thinking about that, you know, are these little images useful, distracting? You like them? Okay. The little icons, kind of. Sorry, Elise, what did
Different color.
Different color. So
Yeah.
yeah, just
Yeah.
that turquoisey green
They
is
should
hard
be
to,
blue. They should be blue.
Yeah.
I don't know why they're not.
that kind of, yeah, make them pop, I think.
Different color, perhaps like different variation of blue, but this page works well in blue and black. So why not keep the green ones to some kind of variation of blue?
Okay,
Uh,
yeah.
the button is blue.
Oh, oops. Sorry, I was going back to try to find, like you said, it's, it is a little bit harder to get through this when you're going through. You know, did you feel like kind of the discussion here about these risk evaluation and mitigation strategies or REMS, anything there, I guess, that you wondered more about, or or just having the link there, or the, you know, any words, I guess, kind of around that, and how it's described, that could be better.
I'm not gonna lie, I don't even remember it talking about dependence.
I
Okay.
don't remember it.
Okay.
I mean, I would definitely want to know if I would have the possibility of becoming dependent upon it. Like,
Yeah. Yeah.
because I mean, you know, if you have more addictive personality versus non-addictive, I feel like that would be something critical, at least personally for me, just knowing that, especially if something like that runs in your family.
Yeah.
And there are, I don't know if anybody's ever tried Effexor, but I did, and I think I tried it for 2 years, and it took me over a year to get off of that. It was impossible.
Why was that impossible?
All the side effects of, I mean, you couldn't even go down from one tablet to half a tablet, give that a couple months, then a quarter of a tablet, and then stop taking it at a quarter of a tablet. It just didn't work. I felt like you had to continue going down. And I still felt terrible for probably a year after that.
Wow. I was actually prescribed the Effexor one, but chose not to take it.
Good call.
Yeah.
Maybe it's a fun exercise, I guess, as you've been through this. If you had to imagine that you were making a treatment decision, did you feel like you would have made a decision, or maybe didn't even kind of cross your mind to think of it that way? But just
Nose spray.
nose spray.
Definitely no spray.
Nose spray.
Yeah. I don't like when people seize my brain. It just seems really problematic to me.
Scotty, you mentioned you had somebody who was successful with ECT.
Yeah.
Does that kind of play into your thoughts as
A
you...
little bit, because,
Mhm.
yeah, she was
Yeah,
a very different person.
yeah.
Yeah.
So you saw her before and after the treatment, and she
Mhm.
was happy, is that correct?
Mm-hmm. Very happy, yeah.
Anybody else?
Maybe she was lobotomized. And that was the only other emotion she, yeah, I don't know. It seems scary, like when you imagine that they will put you, I think for ECT, they have to put you under, right? And then they create mini seizures in your brain. I mean, when you think about that, you're like, shit. I mean, and then they also give you a relaxant because your body could seize up and your muscles could seize. And you're thinking about that.
Yeah.
And you can't help but wonder, something in my brain could snap or rewire itself in a weird way. It's like I was a little, when I read through the description, it scared me a little. So the no solution seemed like the safest way.
You did mention, though, I guess you felt that it was balanced, so hopefully the decision is made, you know, more just because of the whole picture and thoughts versus, and obviously everybody has preferences, right? Some people are, that procedure, you know, procedures like that may be just something they're not kind of willing to do, but any other, you know, as we think about maybe some of the wording or just any other thoughts as we kind of finish off the discussion that anybody had that we should maybe consider?
Will this be a handout, or will this be consumed digitally by the patients, or both?
It is meant to be digitally, so that it would be a website, again, whether that's, you know, something that your healthcare professional may direct you to, as, you know, they want to initiate a discussion about, you know, that currently your treatments might not be working, so, you know, why don't you take a look at this? You know, it may be something that is publicly available. That is kind of yet to be decided where it lies. But it would be that it would be online, at least at this point.
Or maybe it was the way that just the data was, but the TMS seemed to be kind of a afterthought
Okay.
to me. And like
In
they-
terms of just what was presented, or?
Yeah, like, I don't know, I just thought it seemed like, well, here's another one, but it's not as something as effective, or I don't know,
Okay.
Like a fill-in?
kind of thrown in there, yeah. Even though I know it is another treatment besides medicine.
Yeah, do you think just reordering it, or maybe the content wasn't quite as
Maybe.
robust, or?
I mean, but then when you finally looked at all the thing, it did say that it was less effective, so maybe that was just it. But it just
Yeah,
seemed-
but it's
I didn't take it as seriously since it wasn't as effective.
effective, okay. Any other thoughts?
I did think it was a little strange that ECT and TMS were not written out, but ENS was.
Oh, okay, yeah. So maybe abbreviations,
Abbreviations or full
Yeah.
names.
yeah, yeah. Okay, that's great, great point. Yeah. Any other kind of words or
I could see there being a FAQ in there, like,
uh-huh. Kind of at the end in the
Yeah.
terms of a summary or something?
yeah,
Okay,
just some questions that people might have.
uh-huh. You know, Leo, you mentioned it, you know, there is a lot of information. I guess anything that, as you look at some of these screens that has too much information, that could, you know, you felt like could have been combined, or it was kind of segmented
I feel
somewhat
like
appropriately?
what would be very, very helpful is that if I don't want to read this stuff, this should all be made into a video that I can click and watch. So on the first page, you'd be presented, okay, here's a video on nose therapy. There's the other two options. You can watch individual videos, or you can watch one combined video. And this way, you would consume all of this information by watching as opposed to reading. And to me, I remember things when I watch, and especially if it would be like with people, and it would show you some of the procedures, like how all these, perhaps that would be easier to consume if that was all in a video format as one of the options. People can still read, but you'd be given an option on video.
Any other thoughts, just in terms of kind of content? You know, as we mentioned, you know, if you could go back and forth, that might be more helpful than just kind of clicking along, and something that will be functional.
I mean, I think on one hand, like forcing, like for the first the first go through, almost like forcing you to look
Mhm,
at
at
everything, isn't
everything.
necessarily it's not the worst thing, but then once
Then
you
you
kind of
can go back through,
yeah,
just to
hop
make sure
around.
somebody gets the full
Yeah.
information versus
Yeah.
selective kind of education on
Is
it.
there information about like how much insurance, how often insurance covers this? I can't remember.
You know,
Yeah.
yeah, with everybody's insurance being so different,
Yeah.
that's kind of hard, but,
Okay.
yeah, so I think the cost is,
It's in Medicare, Medicaid.
Yeah, I thought I did a little bit.
Yeah.
yeah, it talks a little bit about.
Yeah, I
what
guess
that
with
might
people
be.
having deductibles differently and everything, yeah.
Yeah,
So you can at least get a sense of like the max, well, sort of the maximum you
Yeah.
would be paying in like worst case
yeah, worst
scenario.
case scenario.
And it did say that, you know, some may be out of pocket. So
Yeah.
it's not a shock to people, but.
That's true.
Yeah. Right. Any other just thoughts? Well, thank you all for your time today. I really appreciate your thoughts and insights and hopefully helping us make this a better resource for people.
Do you want us to leave these here?
Oh, sure. Yeah, that'd be great. Thank you.
Thank you so much.
Thank you. Have a wonderful evening.
Do we just head back out where we?
Yeah, if you just go back by the office, or the front desk, I mean.
Thank you.
Thank you.
Thank you.
Thank you.
Have a good night.
Thank you, you too. At least I don't think it's raining.
Not yet.
Yeah, I'd say, right?
Later.
It's Chicago spring here.
Yeah.
I guess hopefully we have lots of good flowers to show for it.
There's lots of tulips. I was really impressed with the tulips.
Tulips, yeah, and the gorgeous, yeah,
A
yeah.
lot of work.
Yeah,
Thank
thank you all.